Good evening to all of you all. I have a small presentation to do and then a small talk. I think in the morning you all heard enough from my end. So just to give a brief on Colombo Plan, one thing is that we are very privileged to be a part of it. Started in the 1950s, Colombo Plan, the Australia, and helped many Sri Lankans, including politicians, and many academics over the years. And then about 2 years ago, they wanted to reverse it a little bit, and they formulated the new Colombo Plan. Then, if you look at organizations like IIHS, as like a small-scale organization has benefited, like Dr. Nihal mentioned. With this, we are very happy that we are going to be a part of it for the next 5 years as well. Just to give you a brief on the IIHS mandate is that we are generally looking at creating a global incubator. We have been conducting many research workshops, conferences, and aligning with international standards. We have many affiliations, Australian, Malaysian, and few UK and United States are our collaborators. So we get them together. We have been conducting this incubator where we try to incubate the knowledge and spread among Sri Lankans, which will benefit the total healthcare system. Then this is the first UNA visit. University of New England initially contacted us. At that time, you had Mr. Rishan Shekhar and Gabriel was instrumental in organizing this. And then we put our hands up, and that went well. So this time as well. And to organize things like this takes enormous amount of support and planning. And we have been blessed with many. The deacon supposed to send nearly 20 to 30 students for 2 weeks. That will be in November. Similar. And just to brief you on the planning aspect of it, as in Australia, Sri Lanka also has regulations. It is not easy to get into this regulatory framework and you want to move into a hospital. Since we had the war for 30 years, there's a circular policy that foreigners are not allowed to go into government institutions without the approval of the defense minister, defense secretary. It is still there. I think it will take enough, but still, if anyone wants to say no to something, that's a very good policy to act on. So luckily, we have able leaders like Dr. Amal Harsha and many medical administrators. Most of them are colleagues. Have been very supportive and to organize this. I think we got an overview of what you all obtained in terms of the knowledge and skill of the Sri Lankan health system. I should mention here, this lady down here, Nandika, has been coordinating this is the second time. So we are going to make a permanent part of the Colombo Plan. I think Charlotte would have to organize an allowance for her. Now, just a brief on the journey of IIHS. I mean, we started with the vision of to be the heart of innovative development of healthcare professionals for the globe. Last 14 years we have been fairly small, but we have been doing very well in terms of the quality and the outcome of all these programs that we have conducted. As you can see, Dr. Amalas is just there. When we started in 2002 in Kandy, and we had our health secretary also, Dr. Abdullah again, and then Dr. Julia here, morning also saw the name of our library after her, and this is IIHS. And then what we could do, the simplest thing, and the simplest thing we could do to attribute this whatever that we have gained to our founders. So we named our auditorium, the old auditorium, after Dr. Leonard Ranasinghe. I call this, I named it as old because now today we opened the new one. So and then Dr. Nihal Silva, the other founder of this beautiful school. We named the simulation lab, nursing simulation lab, and Dr. Julia Pierce, she's a founder, one of the founder, who supported us with the curriculum. She's an American nurse, and we named the library, which we opened today, and then of course we couldn't miss Dr. Amala Charisela, who helped us enormously. And this auditorium, which is a beautiful one, and unfortunately we couldn't get him down there. He actually visited, by mistake he had a miscommunication. He has gone to IIHS at 6 o'clock exactly. And I wonder how he came within half an hour here. Discuss that. But this is the least we could do to them. And these pillars are the the foundation we build on, and we are very grateful that they have been helping us right throughout. So if you look at our concept, it is the part of the Australian education framework as well, inclusivity. What the government does, as a third world country, we could accommodate few people in the universities. Just roughly to be around 22% of the total people, students who sit for advanced level examination, only about 20%, then 80% will have to find someone. So what we do at the bottom of the pyramid. So all the students that we have got right throughout has been the bottom of the pyramid. So this is the concept that we started with, and what we did to transform them into an international level, we developed programs to fit the international arena or the international level of job market and the industry. So we developed all the programs and benchmarking most of our university partners. Then once they came into the institute, we found that they have different levels. They are generally discarded by the society and the education system as people with low IQ. That's what they say, and discarded by the family, saying that they are useless versus the one who studied and went to the government university. So when we looked at them, and they had different learning styles. They are learning, traditional learning of our universities, our education has been a basic linguistic and logical. There are voting techniques that we use. So we generally use everyone. We do a learning style assessment, and then we deliver our programs as per the learning styles, matched learning styles. So we did a research recently. We are about to present a paper in UK by the end of this month regarding these learning styles. We found the learning styles are expanding, and then when they work with in collaborative. The collaborative learning and the delivery methods have improved their learning methodology so as their absorption of the knowledge and skill. We are still, it's a longitudinal study, so in a couple of years we should be able to get more info regarding this. But and then most importantly, we inculcate the research into these students' mindset. I think Dr. Mary and the whole crowd got the insight to what we are doing, and it's evidence-based healthcare, evidence-based medicine. That's the concept that the whole world is moving on. And currently, with this respect, we have published close about well over 250 research publications for the last 3 years, and almost 40 publications internationally. They have gone out and published. By the end of the year, we will have well over 60 students going out of the country to publish their research. They are just diploma students, I mean, below undergrads. It's kind of it's fairly a big challenge to get them there, and we are really, really proud about our achievements. And then it is not enough for them to go into the international arena. You have to really polish them up. So in terms of the personality development, we do have a module of each program what we do, a personality development. We really look at their personalities, and then we include the etiquette, and then there's IELTS inside that, because without English and IELTS, they can't go out of the country. And then parallelly, what we do is we give them tools to sustain when they go out there. For example, for the nursing students, they do general nursing, but we give them a certificate in aged care. So when they go out there to Australia or any other country, their part-time job would be doing something related to aged care or similar industry. So by the time they graduate, they have the insight to how the system works. But if you go into the university itself, they will not get this hands-on thing. So generally, IIHS students, when they go out, once they pass out, they are highly regarded by the industry, and then their job attainment has been quite easy. And this is what we do. When we started with a diploma initially, now we do from certificate to the bachelor's to the master's to the PhD. Currently, there's about 5 PhD candidates. 2 of them are nurses, and one is here, Ms. Ashoka Abhinayaka. She's the principal of the post-basic nursing school. And we have Nadika, the other nurse who's reading for the PhD, and 1 doctor and 2 others. So we are moving on. In a way, it's good to have obstacles in our organization, because we have been only supported by few officials like Dr. Amalha Chadiseva. So traditionally, the government sector would look at the private sector as not as a positive entity. So what we did was, like, instead of trying to try to award degrees by ourselves, we went out there and collaborated with many universities. So that has been a success of our achievements up to today. So these are our partners. We have close about over 10 Australian and some UK and some about 1 United States university with us. So these are the local contributions that we have done other than the academics. We have been supporting the disasters. Recently, all of our academics and most of the students went out there for the disaster relief. We conducted many medical camps. And then we do educational support for the other nurses. We go out there, do workshops all around the country. And then currently we have conceptualized and planned and about to implement 3 community projects. One is what Ms. Charlotte is supporting us. One is, of course, looking at the road traffic accidents, which is a deadly disease in Sri Lanka. What we are trying to do is to train school children, policemen, and then the 3-wheel drivers, who are the first comers. They are the first visitors in a road traffic accident, to train them on first aid to manage the golden hour. So that's one project. Second one is to develop and manage the school sports teams by our physiotherapy school, and then biomedical science department or the school try to validate the heavy metal content in vegetables that we eat. So we are looking at followed by it will be another community project to create awareness of this. Today we can say we have been transforming people. I mean, initially we thought we are doing a service. recently we had a management committee meeting, and we found that we are no more doing a service. We do products. We produce healthcare professionals. So what we thought was, then looking at it, we transform people. Now all these, like Ayodhya was in UK, Punisha in Australia, Melbourne, and Charita is in Adelaide, this girl in Takisha, she's in United States, and this is Saman Jiva. Saman Jiva is a government theatre nurse. Now he's in Dr. Frontiers. The other boy is also in United States. So we've basically we have transformed them into different professionals now working all over the world. So then we thought it's time for us to change our vision to transform people, the community, and to landscape and through innovation. This is what we are going to work in next 5 years, and with this context, what we are going to do is to do better what we are doing now, and then to expand our wings to regional centers. Hopefully, Bangladesh might be one of our centers because our major programs are on a Moodle. We could deliver online with the support of the partners there. And then the most important thing is to reverse the trend of exporting skilled labor. Ms. Charat has been behind me, supporting right throughout, even getting the appointments from our own ministers, which we could do, and we are still working on it. As we all know, our main income comes from the housemaids. That's the very unskilled labor, and 45% of there are about 2 million people working outside the country, out of which about 45% are housemaids. And the enormous amount of social and the economic implications are immense. And what we thought was to organize give some skills for them as healthcare assistants, and then to train them. In terms of the revenue, it's 4 times the income that came by the housemaids. Healthcare assistants could earn as well as a very secure environment. So that's one of the areas that we are looking at, and then of course getting back to the new vision to transform people, community, and the landscape. Thank you very much.